Hi, in this video we'd like to discuss the nature of PCOS and continue on our series on PCOS diagnosis and treatment at Antai Hospital. So today's topic is discussing whether or not PCOS is a congenital disease or a genetic disease that you inherit from your parents or grandparents. So we have many patients that come for treatment at Antai Hospital for PCOS, and they are worried that because they want to go for pregnancy, they're worried that their children will also develop PCOS. And to answer this question, rest assured, your children will not have PCOS if you have PCOS as well. So in many cases, our patients who have PCOS, their parents, their grandparents do not have PCOS. Now, PCOS arises because of certain factors that affect your growth and development during embryogenesis, which means when you were still in your mother's pregnancy, in your mother's womb, certain factors, some external or internal factors, has affected specific processes of the embryogenesis that caused you to develop PCOS. So, although PCOS is a condition that you are born with, it's a congenital disease. You don't develop PCOS over time when you are growing up. It's something that you are born with since young, and it will develop symptoms over time, especially when you go through puberty. It's not something that you acquire later on. However, it's not something that you acquire from your parents as well. So to go into detail, during embryogenesis, which means this is the first 3 months, very crucial development of the pregnancy, there are specific sex cells that we call as gonad cells. Now these gonad cells will eventually differentiate into ovaries or testicles, depending on what kind of sex chromosome this pregnancy is carrying. If it's an XX, then it will become an ovary. If it's an XY, then it will become a testicles. That's how we determine the baby gender during week 9, week 10. So in the first 9 to 10 weeks, this is happening. The differentiation process is happening and it takes time. However, if some external factors or internal factors affect this process, it may cause some problems. What problems arise is because of these ovaries do not fully contain ovarian tissue. They contain some amount of testicular tissue as well. It's a combination of both tissues, a bit of testicular tissue and a majority of ovarian tissue. Now, this combination will lead you to have PCOS when you grow up later on. For healthy females, they will have majority high amounts of ovarian tissues, almost no traces of these testicular cells. So this is an abnormality, the key differentiating factor between why some females don't develop and some females do develop PCOS. So keep in mind, it's not a genetic condition, it is a congenital condition that you develop because something affects the embryogenesis process. So when your mother is carrying you in her womb, factors that can affect this process are separated into two groups: external factors and internal factors. External factors include the environment that she resides in. There could be some high amounts of radiation, some biohazard, some chemical exposure. It could even be the food and water that she drinks, some medication that she's taking. Internal factors include certain diseases, including adenomyosis, some polyps, uterine fibroids, anything that can affect the pregnancy from developing healthily, because it competes nutrients, glucose and oxygen with the pregnancy. It can definitely cause some problems during this important process. So this is how you develop PCOS, and it's an entirely preventable condition if you do go for a thorough diagnosis before pregnancy. So if you do have PCOS in your later years, when you do get diagnosed, rest assured Antai Hospital does offer you a highly effective treatment that can help you relieve all the symptoms that you associate with PCOS, including the excessive body hair, insulin resistant, the missed period or no menses period at all, and then also the excessive acne facially and also bodily as well, and several other symptoms associated with PCOS. Not only can you get treated where your symptoms will disappear, you can also attain natural, full-term, healthy pregnancies as well. And rest assured, your children will not have PCOS because it's not a genetic disease. You won't transfer this gene to your offspring. As long as you take care of yourself, eat the right foods during pregnancy, you will rest assured your children will not have PCOS. So get in touch with us as soon as you can via the website, set up a consultation. Let's discuss how we can help you attain your pregnancy goals today with Antai Hospital.